here, and then after that, I'll let you tell them kind of where you've been since then. But Dr. Kevin Cox.
Hello. How are you? How hot and sticky? Yeah. Well, we'll try not to keep you here too long then. Brad is right. I went to school here before you were born. Literally before you were born. And then I graduated and went straight into vet school. I graduated from vet school in 1998. And then I went into private practice. During that time was when I was doing an adjunct professor here teaching farm animal health. So I had some really kind of unique experiences in private practice. A dog bit my left thumb off. A mule broke this arm. It was a compound open fracture. And then a horse smashed my face. The left side of my face has been completely reconstructed. So any of you that are thinking about going into veterinary medicine, maybe you should get good health insurance. Anyway, after those 3 injuries, I was there in private practice for 6 years. I looked for another opportunity that was maybe a little bit less deadly. And I started working as the staff veterinarian for Tennessee Farmers Co-op. And I've been with that company for the last 11 years, doing educational things, employee education, client education, technical support for products that we sell. The last 4 years, I managed the animal health department, just a business unit at the company. I managed that. And then April of last year, I became the chief operating officer of an animal health distribution company that Tennessee Farmers Co-op started. So now I have very little responsibility for vet work. I'm running an animal health company, which is quite a bit different than what I used to do. So I have a really strong interest in Repro. About 3 years ago, I decided that I wanted to go back and be board certified in theriogenology. So I started a non-traditional residency in order to get my diplomate status, and I was supposed to sit for my board exams in August. And it would be great if you could pray for me that I pass that test. If I don't, I'm going to have to study for an entire another year. So my job today is to talk to you about equine. So what we're going to do is focus on the mare mostly. In the handout, there's a lot of information about the pregnant mare, the open mare, and the stallion. Probably what we'll just focus on today in the room is the open mare. And then, Brad, you can use that information if you want, and you can just read the rest of that. It's a lot of information. We won't have time to cover all of that. You'll get very uncomfortable sitting here that long. So what I'll try to do is focus on some anatomy, a little bit of physiology, and how that's different or unique from the cow. I think you all have been spending quite a bit of time with the cow, so you can focus on the differences. And things are relatively similar, but there are some key differences that I think that you'll find are pretty interesting. So any questions that you have, please stop me. I prefer conversation. I'm not a good lecturer, so it's much more beneficial to you and to me if we're conversational. So if you have questions as we're going through, just yell me and yell them out as we go through, and that way we'll get them answered as we go. So here's the outline, basic information. I want to just tell you a few things that are just kind of unique to the horse itself. We'll talk about some anatomy. There are some unique things about the mare that make her a great candidate to work on, and then there are some things about the mare that make her a troubling candidate to work on in terms of reproduction. We will talk a little bit about the physiology of the non-pregnant mare, and then I'll let you read about the pregnant mare. We will come back and hit some of the fun things about assisted reproductive techniques at the end. There's another section that I added on here. Horses are seasonally polyestrous. What does that mean? A cow is what? She is what? When does a cow come in heat? Every 21 days. What times of the year? All year round. So she is polyestrous, right? She's a polyestrous animal. But the horse is seasonally polyestrous, meaning that the mare only cycles during a certain time of the year. So what time of the year is the mare normally cycling? When are people breeding horses? Right now, right? So a mare begins to cycle in the springtime and will cycle throughout the summer and into early fall. And then in the fall, she will stop cycling. So mares are in anestrus. They do not cycle during the late fall and winter months. Okay? When do we want a mare to have a baby? Anybody have horses? How old's your horse?
18.
When's your birthday? His birthday.
April.
Okay. What kind of horse?
Paint.
When does the Paint Association say she was born?
January 1st.
January 1st. So we want mares to have babies when? As close to January 1 as we can possibly get, because almost all breed associations judge a horse's age by January 1, not by when their actual birth date is. So if you have a horse that you're going to show, you're getting ready for futurity or something like that, the breed association is going to assume that that horse was born on January 1. So we want mares to breed early enough to actually be having a baby in January. So if the gestation of a mare is 343 days, when do we want to breed a mare? When do we want her to have a baby? We want it to come as close to January 1 as possible. So when does that mean we need to be breeding her? February, March. So if a mare is seasonally polyestrous and she's anestrus during the winter, does that create a problem for us? Because she's not even beginning to cycle until when? March, April, May. She does not want to have a baby in February. That's a man-made thing. That's not natural for the mare. So we have some difficulties and some challenges to try to adapt to in order to get those mares to have babies earlier in the season. They do have a 21-day estrus cycle, which is similar to the cow. We talked about that, and we're going to come back and look at that. There are some differences about LH peak and all those things that make you nauseous to look at, but there are a few differences about that between the cow. We really don't like for mares to have twins. The chance of a successful twin pregnancy in a mare is less than 5, of delivering both foals healthy and alive and actually being successful. So we prefer not to do that. Most breeding is done either by hand, artificial insemination with cooled or shipped semen, or frozen. There's very little actual natural breeding in the mare, where you just turn the stud out with the mare in the pasture. That's not done very often anymore. With horses, horse values being as high as they are in some circumstances, it's just not safe to turn the stallion out with a mare because he could get hurt pretty badly. All right, let's talk a little bit about the anatomy of the mare. Somebody describe the cow uterus to me. You've palpated hundreds of them by now, so tell me what it feels like. Surely you felt it. We hope you felt it, right? What does it feel like? Is it long, tubular? What size are the ovaries? Nobody knows. They've never felt them. Okay. The mare's ovaries are a little bit bigger than the cow, and they're a little bit further forward. So if you are comfortable feeling of a cow, you know that her ovaries are going to be almost back to her pelvis, right? They're not very far in. The horse is much further forward, much closer to the kidney, and instead of pecan size, they're going to be at least walnut size during anestrus. Okay, so if you went and palpate a mare in the dead of winter, her ovaries are going to be about walnut size. And this time of year, when mares are beginning to really cycle, her ovaries can be as large as tennis balls. Okay, and that's completely normal. Nothing abnormal about that. Okay? The shape of the uterus is not as tubular as the cow. So the cow has a very short uterine body and very long uterine horns. It's not that way in the cow. In the horse. It's kind of Y-shaped, and it really doesn't even feel like that there's a long tubular structure because it's short. It has a great elasticity, can expand, obviously, for a foal, but it doesn't have that long tubular structure like the cow's reproductive tract. Let's talk a little bit about the cervix of a cow. Have you inseminated? Anybody inseminated here yet? Have we tried to pass a pipette? So, trying? Right. So why is that word trying? Why is it hard? Why is it difficult to pass a pipette in a cow? So they have those really nasty folds, those interdigitating folds of the cervix that make it difficult to go through. Well, good news. There's none of that in the horse. It's a wide open space. You can drive a truck through. No, I'm just teasing. But it is really, really open. There's no interlocking folds. It makes it extremely easy to get the pipette through in a horse. I could have you all inseminating horses in 5 minutes. It's really, really, really simple. There's no way that you can miss that. Now the cow, obviously it's much more difficult. So they have a really good open cervix, and there's just one tiny little place where it closes up at the end, all right? And then during estrus, that is actually open. The vagina is long compared to the cow, and there's this fold here called the transverse fold. It's a remnant of the hymen, and it is another way to keep bacteria, debris, things like that from getting into the reproductive tract. So this transverse fold, if you were to use a speculum and actually look at the reproductive tract, if you were going to go into and just try to visualize that, you would actually see this fold here. And then of course the vulva there is there to keep other things out as well. So one of the things that we want to look at specifically when we get the mare, we're going to evaluate her reproductive anatomy. We're trying to decide, is this mare a good candidate to carry a baby? And we have a rule of thumb that the rectum should be vertical with the lips of the vulva, okay? And you say, well, that would seem kind of natural, that would seem kind of normal. But many mares have the reproductive conformation that their rectum is recessed up into the rectovaginal vault is the fancy word for that, but the body cavity. So if the rectum is short and recessed, that creates a slope here where fecal matter is falling and coming down on top of what? The vulva. And so if you have this poor conformation, this is a mare with poor conformation, you can see her rectum is recessed back in here. When she defecates, it's just like there's a little shelf here to catch that. And obviously, that's a bad thing, okay? If you notice, this mare, because her rectum is recessed, we have the pulling away of these vulval lips creates a little bit of a space, an open space there. Another reason that bacteria, debris, fecal matter can get into the vaginal vault. All, again, making it more difficult to keep that vaginal vault clean. So why do we care about that? Why do we care that her conformation is not straight up and down? We want it to be 90 degrees. Why do we care that it's not? If there's a risk of infection, so there's an infection. What does that mean? She's more likely to be unable to get pregnant, and then if she is able to get pregnant, she's unlikely to maintain that pregnancy. Okay? So her reproductive capacity is greatly decreased if she has a reproductive conformation like this. So we'll talk, when we get the mare up, we can talk about some ways to repair that, some ways to fix it. If any of you have worked in veterinary clinics and you've talked about or heard people do Caslec procedures, that is a way to repair this so that the mare is not in poor conformation. All right, so when you palpate a cow and you hopefully feel the ovaries, which you all are so shy about admitting that you have, are about pecan size, what can you feel on the ovary of a cow? What are you supposed to be feeling on the ovary of a cow? Follicles. After the cow ovulates, what does she have? She has a CL, stands for a corpus luteum. Can you feel that in a cow? You're supposed to be able to feel that in a cow. Well, unfortunately, in a mare, you cannot feel the corpus luteum. The mare's ovary is made backwards, okay? So the anatomy of a normal animal has the inside part of the ovary is called what? Anybody remember? The medulla. Very good. And then the outside is the cortex. So all of these follicular structures are on the cortex. You can feel a primary follicle, an antral follicle, or a mature follicle we call them. And then after that is ovulated, this is the CL. Okay, you can feel all of that in the cow. In the horse, it's made completely backwards. The medulla is on the outside of the ovary, and the cortex is on the inside. So you can feel follicles, but once the mare ovulates, you cannot feel that corpus luteum because the mare can only ovulate from one specific spot on her ovary, called the ovulation fossa. Because it's only one spot, and it's kind of turned upside down, you can't palpate that in a horse. So when let's just say you're trying to get this mare bred, and you've been palpating her every day, you don't have the luxury of an ultrasound machine, you can feel a follicle, it's getting bigger, 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 bigger. You hope she ovulates, but you can't palpate a corpus luteum. You can't tell that structure is different because it is in a specific spot that you can't reach. So that's why an ultrasound machine is almost imperative in reproductive work in a horse, because of this anatomy feature that makes the mare so difficult to palpate the corpus luteum. Okay? All right, any questions about the anatomy of a mare? We're going to skip this stallion anatomy. You can go back and read that if you want. So we talked about that mares are seasonally polyestrous, and meaning that they cycle during certain periods of the year. They're only going to cycle in spring and summer and maybe early fall. What stimulates that, what controls that, is photoperiod, light. Okay? So a mare needs increasing long daylight lengths in order for her to think that it's time for her to cycle. So we want your mare to have a baby. She's in the dead of winter. She's not going to cycle. How are we going to encourage her to be ready to breed by February 1 so we can have a baby by January 1? How would we do that? We're going to keep it in a lighted area. So we need at least 16 hours of daylight. 16 hours of daylight, preferably by adding daylight at the end of the day. So normally in the winter it gets dark, what, 5 o'clock? So we're going to put her up 5 o'clock and start leaving the lights on until about 11 that night. And we've got to do that for a minimum of 30 to 45 days before she thinks, hey, it's springtime. I'm going to start my ovaries up. Okay? So we've got to do that in, they say 1,600 candle watts, or wattage, I can't remember though. But you just need to be able to read a newspaper in her stall. Okay? If you were going to go study in the stall, you need to be able to read your notes. Okay? So that's the idea there. This is the physiological way that happens. Maybe that's a little bit detailed. You may or may not want to know that. But we're increasing the daylight hours to make her think that it's later in the year in an attempt to get her to cycle. Okay? All right, let's talk just a little bit about the estrus cycle. Did you do this? Did you all do this for the cow? Have you seen one of these before? So you know these hormones. You could draw it for me if I ask you to draw the cows. You can label it? Okay. So one unique difference about well, first of all, let's talk about the cow a little bit. How long is the cow in heat? The cow is in estrus. How long is she in heat? You got how long to breed her? About a half a day, right? So hours-wise, how long is she in estrus, in standing estrus? 12 to 18 hours. 18 would be the long end of that, right? How long is a mare in heat? Anybody know? 5 days. 5 days, forever, right? 5 to 7 days. Some mares will drag it out to 7, but it's certainly much, much longer When the cow ovulates, it's over, right? She's going to ovulate. She's probably going to have her LH peak at the beginning of that 12 to 18 hour cycle. And then the LH peak is going to spike straight up. She's going to ovulate, cow goes out, it's a done deal. You know, in 24 to 36 hours, it's all over with. And if you were asleep or if you were out of town, you missed the whole thing. Well, in a mare, she stays in heat much longer, so she has this really wide window of high estrus. Another thing that makes her difficult to breed is that her ovulation is very unpredictable because she does not have a true LH peak. In other words, her LH does not go straight up and straight down. It's kind of a mountain here, kind of like her estrogen curve. So instead of peaking straight up and then coming down really, really quickly and causing ovulation really quickly, it's kind of lackadaisical about it, okay? The LH is like, well, I think I'll get a little higher, a little higher, a little higher, a little higher, and it'll stay up for a little while before ovulation actually occurs. So that is a challenge when it comes to time for us to do artificial insemination, cool semen, because the mare's LH peak is much more difficult to predict than the cow. Once you see a cow standing in heat, you know that LH peak is coming very soon. You've got to get semen in that cow very, very quickly. In a mare, you could breed her 2 times, possibly even 3 times, and she may or may not ovulate after you inseminate that. Okay? So one of the things that we typically do is we induce ovulation. How would we do that? How would we induce ovulation in a horse? Have you talked about reproductive cycle manipulation in the cow? Co-sync, off-sync, all those fun things. How would we induce ovulation in a cow? Do what?
Start off with PGF2 alpha.
You could start off with PGF2 alpha. We're going to synchronize her, right? Going to make her come in heat at a certain time. And then what's the drug that we would use to make her ovulate? I heard somebody say it. GnRH. So cisterellin, okay? That's one brand name of that drug. So GnRH, we're going to cause that LH to spike up using the hormone GnRH. But we can do that same thing in a horse. We're going to use a different drug. It's still GnRH, but we're going to use a different name drug, okay? All right, one more thing that's different about this cycle than the cow. When the cow is in diestrus, her progesterone kind of drops off very, very gradually right before she comes in heat. The horse stays really, really high until the very end, and then it just, boom, it's gone. Okay? So that's another difference in the cow and the horse. So that you can use that for your reading pleasure when you can't sleep at night. Probably need to be able to recognize these hormones. FSH, what does that cause? What does that allow to happen? What grows? A follicle grows, right? What does the LH cause? We've been talking about it. Ovulation. Estrogen is high or low in estrus? High. When is this hormone high? After ovulation, what's that period of time called? Diestrus. What is inhibit? Talked about inhibit? Stops FSH. So what's the important part about inhibit? Why do we need inhibit? Okay, we want to stop that estrogen. We want to get to a certain size. We want to stop the estrogen, and then we need the ovulation to occur. So if we stop the FSH, but we continue to allow LH, that's going to cause our ovulation peak. All right? And then prostaglandin, like you said earlier, if we want to do synchronization, we can cause that and causes the CL to rise. So which one of these mares is not in heat? The one that's kicking, right? So how do we know a mare is in heat? So let's talk about some symptoms, not symptoms, that are signs that a mare is in standing heat.
Interested in the male.
What?
Interested in the male. Interested in the male.
Interest in the male. Yes, I'm sorry, I couldn't hear it. Yes, that's true. She's going to pay attention to him more. What else? She's going to wink, lift her tail. What's the fancy word for scooting up over to him and squatting? Lordosis. You heard that word? Where she thinks that she's getting ready to crouch and stand still for the animal to mount her. Okay, so this mare here is exhibiting that. You see her, she's, I guess, crouching down in an attempt to steady herself when the stud gets ready to mount. So we're going to ultrasound a mare today, and this is not going to show up really well here, but this is what we would call an antral follicle or a mature follicle, a Graafian follicle. All of those things are the same term. It is a large fluid-filled structure that is just about ready to ovulate. So hopefully we'll be able to see some of those in the mare. So if we have a large dominant follicle in a mare, that's not the only thing that we need in order for us to know that she's in heat. Remember that animals continue to have follicular waves even when they're pregnant. During diestrus, they continue to have those. That's why we get depletion of the reserves in an ovary, right? Can you ladies have babies for the rest of your life? No, there's going to be a certain time when those primordial follicles run out. Males have the ability to make sperm forever, but follicles are finite, a certain number, okay? But because these are continually occurring, these follicular waves are continuing to occur no matter what else is going on in the mare, we need to make sure that she has uterine edema. That tells us that this is a true dominant follicle that is pre-ovulatory. Okay, so this is the second symptom that we would look for, this uterine edema, to tell us, yes, this mare is in heat, she's really close to ovulation, we need to be finding some semen. All right, here's what I was looking for earlier, the transitional period. If we want to advance reproductive capacity in the mare, we're going to have to start doing lice. We can't really shorten that. We can just move it to a different time of the year, okay? And we change that by changing the photo period, adding line at the end of the day. I think we talked about all that. All right, so we've just really talked about how to stimulate a mare's estrous cycle. What if we don't want her in heat? Well, why would we not want her in heat? You've got a performance horse, and she's absolutely nuts crazy when you're trying to ride her or you show her. There are lots of psychotic show mares, right? We don't want her cycling when we're going around the ring and trying to show her, right? But she's going to act crazy. So those are some reasons that we wouldn't want to do that. So there are lots of ways that we can stop that. What would be a pharmacological way? If we have, what's the hormone that prevents cycling, that prevents estrus in any animal? It's high in diestrus, progesterone. So if we give progesterone, that is going to keep a mare from cycling. So you can do progesterone injections, and then altrinogest, which is a synthetic progesterone. Okay, you can give that orally and keep a mare from cycling. There's also some non-pharmacological ways. You can put a marble in the uterus of a mare, and that makes her think, tricks her into thinking that she's pregnant. That marble feels like a little small pregnancy to her, and she's just like, oh, I'm going to have a baby. Except that baby never grows, never goes anywhere, never does anything, and so she stays out of heat for quite some time. Now, that can cause some damage to the uterus, might make it more difficult for her to be bred in the future, but it is used a lot in mares that are crazy. The other thing is you can just take her ovaries out. If you're not going to use that mare for any kind of reproductive stuff in the future, then you can completely take them out. That's called ovarectomy. All right, we talked about all that. Let's skip over some of this stuff about the pregnant mare. Go back and read that if you want to. Really cool if you like mare reproduction. This mare's not pregnant today, right? We probably won't get to see a baby. Move on over to, at the end of that handout, there should be this section on infertility and assisted reproductive techniques. This is the fun stuff, the cool stuff. We talked about in the cow some of the things that can be done to assist reproduction. Why are you trying to pass a pipette through the cervix? What are you trying to accomplish? What technique are you trying to become fluent in? Artificial insemination. So that's commonly done in the cow. And it's actually really, really easy to do in the horse, and it's very commonly done as well. So there's some pretty cool techniques, assisted reproductive techniques. Basically, infertility can be divided into two categories: mares that can't get pregnant, and then mares that can get pregnant but can't stay pregnant. Okay, so two different things. The mare is really prone to reproductive tract infection for the reasons that we've already talked about. The reproductive tract anatomy, that poor conformation, the poor vulvar conformation is extremely common. And so that's one of the things that contributes a lot to a disease, not a disease, that's not the right word, it would be a disorder called a pneumovagina or a windsucker. Okay? So mares that have this poor conformation, when they move, it tends to bring air into their vaginal wall. And it sounds disgusting, for lack of a better word, okay? It sounds like flatulence. It sounds like air moving in and out of something that shouldn't be moving in and out of. So that is where they get this term, the windsucker. So we'll look at that. That's probably the number one reason that we have so many mares that have infertility due to bacteria infection because of their poor conformation. A lot of mares have a difficult time producing enough hormones to maintain pregnancy. So what maintains pregnancy in a cow initially? What? Corpus luteum, right? It's producing progesterone, that's supporting the pregnancy, and progesterone is supporting the pregnancy in a horse as well. Sometimes the mare doesn't produce enough progesterone, and so we have to supplement that in a few cases. They just have a difficult time producing enough. We talked about that twins, extremely rare in the horse, so anytime a mare is pregnant with twins, about 80 to 85% of the time she will abort those twins in the first 6 months of gestation. Okay? So that's a real common reason of abortion. Rhinopneumonitis, EHV, is another common reason that we see abortion. It is a herpes virus. So if you've talked about abortion reasons in cattle, IBR, another herpes virus, that would be the cousin to that virus. And then what's the number one cause of abortion in cattle? Lepto. Okay, so lepto can cause abortion in horses too. It's not as common in a horse, but it certainly can cause abortion in a horse. All right. So, because the mare has this kind of weird reproductive anatomy that makes her prone to getting infections, many times after we breed the mare, we will go ahead and do what we call uterine therapeutic flushing. We're just going to go ahead and flush that uterus with some sort of solution that has an antibiotic in it to clear out any bacteria that might be introduced into the uterus. So if I have inseminated a mare, let's just say I inseminated that mare on Monday, I'm concerned that I might have introduced an infection into the uterus. I'm going to flush that mare. I'm going to use a pipette, just like I would artificially inseminate her, take some fluid solution into that uterus, put an antibiotic in it. Am I risking killing the baby, the embryo, when I go into that mare on Monday afternoon, possibly Tuesday morning? Am I? You probably talked about this in the cow, but remember that the embryo is not coming down into the uterus for several days after fertilization. So we've got several days before we have to worry about that embryo being in the uterus. Where is it beforehand? It's in the oviduct, right? It's still up in that tube that leads from the ovary to the uterus. We've got several days that we can clean up that uterus before we have to risk killing the embryo. Okay, so that's why uterine therapeutic flushing is so common. So we've talked about artificial insemination a little bit. Very successful in the mare, easier to do than the cow. You can all be in the cervix, through the cervix of a cow in literally minutes. But you really just need to understand that estrous cycle. That's all you got to know to be successful, because you've got to be able to control it, manipulate it with hormones, or know when she's going to ovulate so that you can have semen there at the right time. We talked about that it's almost imperative to have an ultrasound machine because of that really wide window in ovulation. She's not going to ovulate as predictable as the cow. So we need to be able to evaluate those structures really, really, really closely. And we'll look at those structures in the mare when we ultrasound the mare that we're going to get up. Same process for cooled and frozen semen. A little bit more challenging with frozen semen. Frozen semen doesn't last as long once we put it back in the mare. So we don't have a very wide window. We need that frozen semen to be as close to ovulation as we can possibly get it. Maybe even after the mare ovulates. If I know that the mare is ovulating and I can put that semen in right away, then that's great. But if I put the frozen semen in, let's just say I put it in on Monday morning and she doesn't ovulate until Tuesday afternoon, that semen is not going to last that long. It's just not, it doesn't maintain viability very well. So that makes frozen semen a little bit more challenging. It's just a mare being inseminated. Helps if you're ambidextrous, right? You've got one hand in the mare guiding the pipette through, and then you're going to be able to push the syringe or the plunger in the semen with the other hand. Talk to me about embryo transfer in cows. No? We do it in horses. The only difference between a horse and a cow is that it's very difficult to superovulate a horse. What's the term superovulation mean? We hope to get a bunch of embryos, right? A bunch of ovulations in the cow. We can use a hormone called FSH, increase the number of follicles that were recruited, and have more follicles that ovulate, hopefully more embryos. That doesn't work very well in the horse. So we typically only get one embryo per flush in the equine embryo transfer. But other than that, it's very, very similar. Synchronization has to be almost perfect. The mare, the donor mare, and the recipient mare need to be almost at the exact same time. That's a picture of an embryo. Okay. That's 45 minutes. You're hot. You're uncomfortable. Any questions?
I do. I have a question about lighting. Does it make a difference for them not to ovulate if you decrease the light in their daylight? I mean, say it's like now, and like you said, you don't want them to ovulate because they're...
Oh, I understand. No, that doesn't work that way. Yeah. No. When it's summer, when it's truly summer, late spring, there's enough natural daylight. Unless you just put her in, like if you put her in total darkness.
Well, like in a barn or something.
No, she's still going to get enough daylight just for windows, doors, things like that. And she's going to continue to cycle in the summer months.
Okay.
Yes, ma'am.
How does that surgery work when you change the confirmation?
The Catholic surgery.
Yeah.
We're going to talk a little bit about that when I can actually show you the mare. Okay? Yeah, I think that's a great question. And I'll be able to show it to you a little bit better. Basically, it's plastic surgery. We're just changing the shape and the formation of the vulva there. But I think I can show you better than I can tell you. Yes, ma'am.
Does, trying to do the same thing, the shape of the vulva and direction and everything, does that get worse if they've had, say if they've never had a problem with that, if they've had multiple offspring, does that make it worse?
Yes. So a mare that's had several babies, things get kind of floppy and lax back there. So yes, that does make the conformation poor. It also happens in mares that are extremely thin. So if you have a mare that is in good body condition, for some reason she loses a lot of weight, that tends to change the shape of the conformation. And it also tends to happen in mares that are quite a bit older. Just older mares tend to lose their good conformation back there. We'll get a mare, see how she is, and hopefully we'll get to ultrasound her so that you can see some ovaries, and we can talk a little bit about some techniques to look at the vulva and insemination, that sort of thing.